Have you ever stopped to think that something as common as masturbation may be silently harming your circulation and gradually destroying your intimacy? So it is. If you are a man and are over 60, what I will reveal now can radically change the way you take care of your male health. The truth is that many men believe masturbation is harmless, even healthy. But what no one tells, not even some doctors, is that there are common errors that over time weaken blood circulation in the pelvic region, directly affecting sexual performance, power, and even prostate function. We are talking about silent habits that sabotage your energy, your virility, and your trust. And no, this is not alarmist chat. They are data, evidence, and clinical experience of urologists who have been following the progressive fall of male intimate health in men who, without realizing it, are repeating the same mistakes day after day. Do you feel your sexual power is no longer the same? Have you realized that your body takes longer to react, that desire has fallen, and that erection is no longer as firm as before? This can be a direct reflection of a poor circulation. And if this circulation is compromised, your body will give signs, but silent, without fuss. Worse, many of these signs begin to emerge from seemingly harmless habits, such as the way you masturbate. But why does this happen? Why is something so intimate and natural becomes a risk factor after 60? The answer is in the details. The form, the frequency, the visual stimulus, the position, the time, all directly influences the penile blood circulation, the functioning of the prostate, and of course, in its intimate life. The problem is not in the act itself, but in the way it is practiced over time. And the older you are, the greater the impact. Unfortunately, many men only realize that there is something wrong when it's too late. When the erection is already weak, when pleasure has decreased, when the connection with the partner is no longer the same. Worse, when prostate begins to give warning signs such as pain, discomfort, or difficulty urinating. All of this may be connected. So in this video, I want to open your eyes. I want to show, based on medical knowledge and real office experiences, the 4 main errors that men over 60 make in masturbation. Errors that are weakening penile circulation, deregulating the prostatic function, and putting their intimate life at risk. And don't think this is a chat of moralism. It has nothing to do with right or wrong. Here, the focus is on prevention, vitality, and quality of life. If you want to maintain energy, avoid erectile dysfunction, protect your prostate, and rescue control over your sexual health, then stay with me until the end. Because what I'm going to show you now, no one ever told you. Maybe not your doctor. But these 4 mistakes, if corrected, can be the first step towards a deep transformation in your male health. And the first one, I'm sure, you have already committed. And if I told you that a simple adjustment in your habit can dramatically improve circulation in the intimate region and even prevent more serious complications such as prostate hyperplasia or even erectile dysfunction? Yes, this is possible. But for that, you need to deeply understand what is behind these mistakes and how they affect your body in a quiet and progressive way. What I will share here is not opinion, it is evidence-based medical information and years of clinical observation. It's the kind of content you don't find anywhere, precisely because a lot of people avoid talking openly about this topic. But here, the conversation is straightforward, clear, and thought exclusively for you. A man over 60 who wants to maintain your vitality and sexual health on the rise. Now, before revealing you these 4 mistakes, I want to ask you something simple but very important. Leave here in the comments if you have had questions about this or ever stopped to think about the effects of masturbation on your health. Your participation here not only helps to strengthen this community of men who are seeking to live with more awareness and health, but also supports others who, like you, have the same doubts and fears. And also take the opportunity to leave the like in this video. This shows YouTube that this content is relevant and makes it reach more people. Men like you who need to hear this and may have never had the courage to ask the doctor or talk to someone about it. Oh, and of course, if you are not already subscribed here on the channel, you subscribe now and activate the bell. Because here every week I bring content straight to the point, without taboo and with full focus on the health of the prostate, circulation, and intimate life of mature man. Information that can avoid suffering, preserve your quality of life, and ensure more and trust in everyday life. Now let's go straight to the point. What are these 4 mistakes that so many men make, and that you may be repeating without realizing it? The first one is one of the most common and, unfortunately, also one of the most destructive when it comes to performance and penile irrigation. Let's talk about him now. Pay attention because it may be the beginning of the turn in your intimate health. Now think to me, what if the problem is not age? What if this loss of performance, this faster tiredness, this difficulty in maintaining a firm erection, or even that cooling in the intimate relationship with your partner, is not caused exclusively by aging? What if all this is being silently fed by a habit you repeat for decades, masturbation, but done in a wrong, automatic awareness? What many people do not understand, and few have the courage to speak, is that the way a man deals with his lifelong sexuality has a direct and cumulative impact on his prostate health, pelvic circulation, and sexual conditioning. We are not talking about right or wrong, moralism or guilt. We are talking about biology, physiology, science of the male body. Masturbation, although natural and even beneficial in many ways when practiced incorrectly, repetitively, and without true emotional stimulus, can trigger a series of silent dysfunctions that accumulate over time. Men over 60, especially those who spent much of their lives ignoring these details, are the most affected. Penile circulation begins to lose efficiency. The vessels that irrigate the pelvic region, fundamental to maintaining a firm erection, to ensure pleasure, and even to maintain the health of the prostate, are being compromised. And this happens most of the time without man noticing. He just notices that something is different. The desire is no longer the same. Sexual response time increased. The erection lost power. The confidence in the hour H shoved. And here comes the question, is it normal because of the age? The answer may surprise. Not always. In many cases, these signs are direct consequences of years of masturbation done automatically, in a hurry, with artificial stimuli, without emotional involvement, without care for one's own body. Even worse when this habit is reinforced by excess pornography. The brain gets used to exaggerated, unreal stimuli and begins to associate pleasure with images and situations that do not exist in real life. The result? A progressive deconditioning of the natural sexual response. This affects desire, performance, and also intimacy with the partner. Many men find themselves trapped in a cycle of frustration, where pleasure is sought in digital stimuli, but real satisfaction becomes increasingly distant. And behind it all, circulation is weakening. Blood irrigation in the prostate and penis region decreases, erectile tissue loses its response capacity, and male health declines. This is the silent problem that no one talks about. It is easier to blame age, testosterone, or stress. But the hole is deeper. Poorly oriented, repetitive, mechanical, and even guilt masturbation, as with many men of generation over the 60s who grew up hearing that this was sin or shameful, can leave deep marks on body physiology. It is not about stopping completely, but of understanding, of resignifying this habit. It is about recovering the connection with the body, about returning awareness to the act, about transforming the way you take care of your sexuality. After all, prostate health does not only depend on exams and medicines, it is directly influenced by the way you deal with pleasure, your vital energy, and intimacy. What's more, sexual deconditioning is real. When a man masturbates the same way for years, always fast, always hidden, always without mental presence, the body adapts to this pattern. And guess what happens? At the time of relationship, this same pattern manifests itself. Difficulty maintaining ejaculation control, difficulty in maintaining erection, feeling that pleasure is no longer the same. The brain and body work together. They shape the stimuli they receive. And if these stimuli are always the same, poor in quality and intensity, performance also impoverishes. This also affects the prostate. When ejaculation is forced, incomplete or very spaced, prostatic secretions, mild inflammation, weight sensation in the pelvic region, and over time, even increased risk of hyperplasia may occur. Many men report discomforts that cannot explain, light pain when urinating, feeling that the bladder never completely emptied, falling into the power of the urinary jet. All of this may be related to this repetitive and harmful pattern. That's why I always reinforcement. Male health needs to be looked in an integrated way. Circulation, erectile function, prostate, and pleasure are all connected. It's no use taking care of one side and neglecting the other. And when it comes to masturbation, it becomes even more critical, because this is a habit that most men carry for decades, without ever having received proper guidance. Many learned in adolescence and never changed. And what works at 20 can be a poison at 60. That's why I need you to reflect now. How have you practiced masturbation? Does it always happen the same way? Always in a hurry? Always guilty? Always with pornography? These answers will help you understand if your body is conditioned to a pattern that weakens or is aligned with a lifestyle that strengthens your intimate health and circulation. And don't worry if you realize that you have made mistakes so far. Most men over 60 have gone through this. The good news is that you can reverse, you can change, you can recover pleasure, firmness, and energy. And now I want to hear you. Comment down here if this makes sense to you. He writes like this: I've realized these signs in my body, or now I understand what was happening to me. This will help me know that this content is making a difference in your life. And if you want to share more, write how your experience was with it. Here is a space without judgments where real men talk about health, shameless and without taboo. You are still here with me, so congratulations. This already shows that you really care about your intimate health, your well-being, and the quality of your sex life after the 60s. And that is precisely why now, the most important time has come of this video, to reveal you the 4 most common and more destructive mistakes that men make without realizing it when it comes to masturbation. Errors that, if not corrected, will continue to affect their circulation, impairing their prostate and gradually destroying their intimacy, power, and even their self-esteem. And the first one may seem harmless at first glance, but it is one of the most dangerous because it repeats so often that the body simply gets used to it. It is masturbation done quickly, automatically, almost like a tension discharge. Many men since adolescence have developed the habit of masturbating in a few minutes, sometimes even in seconds, focusing only on relief and without any mental presence. And the body, which is intelligent, is conditioning it. Over time, penis sensitivity decreases, the brain gets used to intense and rapid stimuli, and ejaculation control is lost. This is why many men report that they are ejaculating faster and faster in relationships, or even before the desired time. What was an innocent and even necessary habit in youth over the decades is shaping neurological and physiological patterns that compromise the sexual response. Not to mention the emotional impact. The man begins to frustrate himself, feeling less virile, less powerful. And often you don't understand why, but everything is there, in the habit that seemed harmless and now charges a quiet price. The second mistake is exactly the opposite, and may seem contradictory, but it is also highly harmful. I am talking about the lack of frequency or long intervals between ejaculations. Many men, with the advance of age, leave their sex life aside, whether for health reasons, out of tiredness, accommodation in the relationship, or even ashamed to deal with the fall in performance. The problem is that the prostate, like any other body in the body, needs activity to function well. Lack of ejaculation for prolonged periods can lead to prostatic congestion, a condition where secretions accumulate, causing inflammation, discomfort, and even weight sensation in the pelvic region. In addition, blood flow in the area decreases, and thus, the drop in irrigation, which is essential to maintain the health of penile tissue and prostate. It is as if the system began to atrophy for lack of use. And it's not an exaggeration. There are studies that show that men who maintain regular sexual activity, even through conscious masturbation, have less incidence of prostatic problems and erectile dysfunction. That is, neither more nor less. Balance is the right way. But if you have been in weeks or even months without ejaculating, your body may be screaming inside, even if you have not yet noticed the signs. And here comes the third mistake, perhaps the most common of the modern era: excessive use of pornography. This is a very serious problem that even affects older men. Pornography stimulates the brain with high dopamine levels, creating a silent dependence as if it were an addiction. The man gets used to seeing highly stimulating, unrealistic scenes outside the routine of any cas communale. And with that, the mind begins to need more and more stimulus to reach the same level of excitement. Result? When you are with your partner, in real life, without cuts, no perfect light, without scripts, the brain simply does not respond the same way. The excitement takes time, erection comes weak or not even comes, and pleasure disappears. This has a name: pornography, induced erectile dysfunction. It is an increasingly common reality among men of all ages, but especially harmful to those already in the 60s, where sensitivity is already beginning to decrease naturally. Excessive pornography also changes the way man connects with his own pleasure. Masturbation is now guided by the image, the visual shock, and no longer by the sensitivity of touch, the breathing, the natural rhythm of the body. This creates a vicious cycle. The more pornography, the less real pleasure. The less real pleasure, the more pornography. And so the body turns off from the real, intimate experience. And finally, the fourth error is a detail that goes unnoticed by many, but has a direct impact on circulation. Posture. That's right. Always masturbating, for long periods, especially in hard chairs or positions that compress the pelvic region, impairs blood flow. And circulation is everything when we talk about penile and prostate health. Without proper irrigation, erectile tissue loses vitality, the prostate can be congested, and the sensitivity of the region decreases. Men who spend a long time sitting, whether working, driving, or even watching TV, already suffer from it. When masturbation is done under these same conditions, the problem gets worse. In addition, the lack of movement reduces oxygenation in the region's tissues, which compromises cell regeneration and favors premature aging of pelvic muscles. And to top it off, this posture can still affect important nerves that participate in the sexual response. It is a silent domino effect that many only realize when the quality of the erection is already impaired. Therefore, it is essential to pay attention to how the body is positioned, the way you touch, the time you dedicate to it. It's not just about the act. It's about how you integrate it with your health as a whole. Now that you heard it all carefully, answer me sincerely. Have you identified yourself with any of these standards? Have you made or still make any of these mistakes? If so, he comments down here, "I need to change these habits," or "This explains a lot that I have been feeling." You can even write which of these 4 mistakes you realize that you have repeated more in your life. This is not just important to me, it is important to you. When you write, you commit yourself, you realize, you position yourself, and this is part of the process of transforming your health. Now that you clearly understand what are the 4 most common mistakes that affect your penile circulation and the health of your prostate, it's time to focus on something even more important: how to reverse these damage. And yes, it is possible. As much as these habits have been practiced for years or even decades, the male body has an impressive ability to regenerate, to recover vitality, as long as you offer it the right stimuli. And it all starts with something simple, but extremely powerful: conscience. Conscious masturbation is one of the most important keys to this transformation. Unlike mechanical, automatic, and hasty masturbation that conditions the brain and body to quick and superficial responses, conscious masturbation is an exercise of presence. It is a moment of connection with one's own body, reconnecting with authentic pleasure, rediscovered natural sensitivity. Instead of seeking just immediate relief, such as an escape valve, the focus becomes deep pleasure, the touch, the breath, the rhythm. This not only reconditions your nervous system, but also stimulates healthier circulation in the pelvic region, revitalizes tissues, and increases the erectile response over time. If you start practicing this new type of touch, without haste, without guilt, without pornography, focusing on what you feel and not what you see, you will notice a significant change. Sensitivity begins to return. The erection gains firmness. Control time increases. And more than that, your self-confidence grows. Because you are no longer just ejaculating. You are getting to know yourself, re-educating yourself, strengthening yourself. And this is a powerful step for any man over 60 who wants to preserve power, protect the prostate, and maintain a satisfactory and full life. But it doesn't stop there. In addition to consciousness during masturbation, there is a physiological factor that few men give attention, but it can make an absurd difference: the strengthening of the pelvic floor. This region of the body, composed of deep muscles that support the genitals, the bladder, and part of the intestine, is essential to maintain erection strength, ejaculation control, and prostate health. When these muscles are weak, blood flow in the region is also committed, and the result is a progressive drop in sexual performance, as well as possible urinary problems. Practicing exercises for the pelvic floor is simple, does not require gym, equipment, not much time. It is enough for you to learn to consciously activate these muscles. as if trying to stop the urine jet. Hold for a few seconds and relax. Repeat several times a day. Over time, this practice strengthens the basis of its intimate system. Circulation improves, the erectile response intensifies, and even symptoms such as urinary drip or incomplete bladder sensation tend to disappear. It is like giving an internal upgrade in your sexual and prostate health, 100% naturally. Another essential change to reverse the damage caused by years of unconscious habits is to drastically reduce pornography. And here I'm not talking about stopping completely, unless you feel you need, but to redeem control, because the problem is not the image itself, but the addiction to intensity. When the brain gets used to extreme visual stimuli, it does not react to touch, presence, the real. Therefore, taking pornography, giving space for your body and mind to reprogram yourself is critical. Use this time to explore new ways to stimulate yourself without relying on videos. Pay attention to your breath, your pace, what you really feel. This may seem difficult in the early days, but over time you will realize that your mind calms down, your erection improves, and pleasure becomes deep, present, true. And we cannot forget the body as a whole. Posture and movement make all the difference when it comes to circulation. As we spoke before, spending a lot of time sitting compresses the pelvic region, reduces blood flow, and compromises penile irrigation. Therefore, changing this pattern is essential. During masturbation, look for different positions. Stand or even lying comfortably. Avoid that hard chair of the office or the softened sofa from the room. And besides, during the day, get up frequently. Walk, stretch, do simple exercises that activate the muscles from the hip and thighs region. This will oxygenate your body, activate circulation, improve your posture, and prepare your body to better respond to sexual stimuli. The male body, especially after 60, responds very well to movement. When you start to get out of physical inactivity, even little by little, the benefits are clear. More disposition, less back pain, improved mood, and, which interests us here, much more sexual vitality. Daily walks of 20 to 30 minutes already make a huge difference. No need to run marathon. You need to move, activate the body, remember that it was made for the movement, and your intimate health will thank you for it. Are you realizing how small changes can generate great results? We are not talking here about expensive medicines, invasive treatments, or magic formulas. We are talking about simple, accessible, natural habits. But most men ignore. Conscious masturbation, pelvic floor exercises, pornography distance, and careful posture and body movement. These are the pillars to restore penile circulation, strengthen the prostate, and recover their confidence in bed. And all this can start today, with small but consistent choices. Now tell me, is any of these strategies already part of your routine? Or is all this being new to you? If any record fell inside, write here in the comments. I will apply it from today. Or, now I understand what I was doing wrong. You can also write which of these changes seems easier to apply in your daily life, or which you find most challenging. This space here is yours. It is a place for exchange, for learning, for support. And your participation in the comments shows that you are committed to your own evolution. If you want to write just one word that summarizes how you felt listening to it all, type clarity or awakening. This will already show me that you are connected with this message. If you have come here, congratulations. This shows that you really care about your male health and are ready to make real changes. Now I want to ask you something very simple but very powerful. Subscribe here on the channel right now, because this is only the beginning of a series of content that will help you protect your prostate, improve your circulation, and redeem your intimate power with 100% natural habits. And if you stayed until the end, I want to know who is really committed. Comment here below. I go you, take care of my male health every day. Write this, or something you felt watching this video. It can even be one word: clarity, change, commitment. This shows that you are with us on this journey and still help this video reach more men who need to hear this message. Enjoy it too, and leave your like. If this content made sense to you, if you brought some new information or made you see the mistakes that were being made in the automatic, click on the like. This is fundamental to strengthen this channel and spread quality information on male health. And to close with a golden key, now watch the next video that is appearing here on the screen. In it, I will show you the daily habits that can prevent the prostate increase and still improve your intimate life in a natural way. Click and continue with me on this journey. Your body and vitality deserve